Hi, my name is Michael Hahn, nurse and magnet champion on HC9, our Cardiac ICU. Today I wanted to give you a little tour of our unit and showcase some nurses who are going to tell you about what they love about our unit, some things that they're proud of that we've accomplished since 2021, and tell you how they are involved on our unit and in the health system.
The thing that I love most about the Cardiac ICU is the passion that people bring to work with them every day to care for critically ill cardiac patients.
Here on CICU, we take care of some pretty sick patients, so I love that I get to work with people where I feel safe and supported when I take care of those patients, and it helps take some of the anxiety away from working in what can be a very high stress environment.
What I love most about working on CICU is the teamwork. I love that I can just go to any nurse if I have a big task of things to do and just give it to them, and they're going to help me out no matter what.
I like working on HC9 because of the teamwork that we have up here. I love working directly with the providers. They are wonderful. We'll always help out when you need, and then the unit culture is great.
I really like about the unit the culture, and I started here as a new grad and I felt really supported in my journey in becoming a nurse.
My favorite thing about the CICU is probably the culture and the supportive work staff.
The thing that I love most about CICU are the people I work with and the patients that we get to take care of. All the staff members here are so excellent, as nurses and also as people, and I really like the variety that CICU gets to see in terms of types of patients and patient populations.
I am most proud of CICU being awarded the Gold Beacon status from the American Association of Critical Care Nurses. This is our third designation, and being gold status is the highest level that you can be awarded by AACN, and it means that we excel in different areas such as patient care, quality indicators, and teamwork. So this is a really great accomplishment and something we look forward to continuing.
One thing that we do a lot in the Cardiac ICU are bedside swan placements with our providers, and it's a really high-risk procedure where the nurse is really involved, more so than any other bedside procedure that we do up here. And so over the last year, one of the unit coordinators and I have been working on a bedside swan simulation to put newly hired nurses through, and it started out really low fidelity, and over the last year we actually gained donor money to buy this Pacerman simulator right here, who actually simulates exactly what we need for the simulation. And another really cool thing that's evolved with the simulation is that in the beginning it was just nurses doing it with the unit coordinator and I, and now it's evolved to where it's an interdisciplinary simulation, and our cardiac fellows come in and they get to practice placing these swans on Pacerman, and the nurse gets to practice all the things that is required of them during the bedside procedure.
There are a number of ways to get involved on CICU. You can attend practice council or serve as the chair-elect or chair. You can precept newly hired nurses. You can serve on our social committee and plan different events for the unit and providers. And one thing that we're very proud of is the Heart to Heart mentorship program, which was brought to us by a nurse that came from a different unit on HC5, Josie Knoll. And she has done a lot of work with Melissa Alsop, our educator, and unit coordinators to be able to pair newly hired nurses with more experienced nurses. Most recently, she was able to do a podium presentation at Magnetizing KC and also present on a poster at the local AACN Chapter Visions Conference. We've had a great time involving that project and have seen a lot of benefit for newly hired nurses getting support and mentorship from those around them.